17 principals who work in low and middle income communities have been interviewed for a study into early childhood development centers. Now, the study shows the lack of support centers has been receiving over the past few years, and just how the COVID-19 pandemic has negatively impacted things like employment, hunger, and even mental health in that sector. It was conducted by Professor Catherine Draper, who's a public health and social scientist with Wits University. The Prof joins us now via our video link for more on what they've been able to find. Thank you so much for your time, Prof, and your patience. It's great to have you on the program. Really concerning what has been found here, especially in a context where we have been told multiple times how crucial it is to focus specifically on early childhood development, considering the bearing that that has on children's capabilities to learn in the future.
Good morning. Thanks very much for having me, and you're absolutely right. So often ECD is highlighted as such a priority, as such a foundational aspect of children's development and setting them up for future success and health later in life. But unfortunately, the commitment in terms of broader systemic support just really doesn't match up to that.
So where are we finding through the study the gaps lie? I imagine, of course, it's got to do with things like funding for ECD centers, which has a ripple effect on many other things that can be provided by these centers.
Yeah, so many of these centers, if not most of the centers, function essentially privately. Some are registered with the government, some are not. If they are registered, they receive a small stipend, but that really covers very little in terms of the operational costs of these centers. And so most of these centers rely on fees that are paid by parents or caregivers, and that is then used to pay salaries or stipends for the staff, to provide nutrition for the children, to provide any other resources that they need. And while there was some government support during the pandemic, this, in terms of the research that we did, it just really wasn't meeting all the needs. And as you can imagine, many of these small centers had to close their doors. Obviously, they all had to close their doors during the harder lockdown level, but many of them weren't able to open because, with all the economic pressures brought about by the pandemic, many parents and caregivers just weren't able to pay those fees. So larger centers were able to kind of carry through. And what we heard from the principals is that many of them just feel this enormous sense of responsibility in terms of the care, the supportive environment, the educational opportunities, and all of that, the nutrition that's provided for children. And so many of them try to accommodate families as much as possible, but many weren't able to open.
Yeah.
And this means that the children have really had this big gap in terms of the input they've received over the pandemic.
Right, and that's essentially what I was going to ask you next. I mean, typically when ECD centers run out of money, what do you find they do first as a mitigation factor? Is it a matter of them insisting that the children who can't pay don't rock up to the ECD centers, or is what they do essentially affecting the quality of, I guess, service that they can give to those children who aren't able to pay?
Yeah, I mean, I think there's a combination. So some the bigger ones where perhaps they have other sponsors or other donors would be able to carry that over, so to able to kind of tide them over that time. But many would have to either not pay staff or have to let staff go, or furlough them or something, and see when they can pick things up again. But the response was quite different depending on what other resources they have available. Obviously, trying to fundraise with parents became much more challenging. So they really were kind of left in the lurch in terms of what they were able to do. And we know that a higher ratio of practitioners or teachers to children is going to produce a better quality experience for the children. And so when you're reducing staff, you're obviously less able to meet the needs of individual children. And then imagining that these children are having developmental delays in terms of the stimulation that they've received to continue to stimulate their development during this time. They themselves are having emotional and social difficulties, which is something that came up in the interviews as well. Many of the principals said children were traumatized. They're trying to figure out what's going on. They're acting out, or they're anxious or crying at school. And so they're having to manage all of that. And their own stress of having to kind of keep things going during the pandemic under all these challenges, having to have the answers, giving parents guidance on what to do. And so you put all of that together, and you can then see how the quality of what they're able to offer and the quality of the environment really can suffer. And at the end of the day, not only do the principals and the practitioners they suffer, but the children, it has this knock-on effect on them and obviously on families and communities as well.
Yeah, interesting to see that what you found is that government's inability or the lack of support from government has a bearing on many things that people would have been able to predict, such as hunger, the quality of education, etc., but also on mental health. Speak to us a bit more about that. I mean, whose mental health are you, for instance, most worried about, or is it just the state of people's mental health across the board?
So I think in this instance, it's really hard to say whose mental health is more important. Obviously, the caregivers, the practitioners, the principals, their mental health is key because they're the ones providing the support and nurturing environment for these children. But obviously, the children's mental health is also a priority, and perhaps that's the part that gets swept under the rug a bit, because young children aren't as easily able to articulate, I'm feeling stressed, I'm feeling anxious,
right.
I don't know what's going on. The home environment is stressful as well. And so I think we often think, oh, well, the children are just resilient, they'll bounce back. And so, intentional efforts to actually address these things with children is probably quite low down on the priority list in terms of other things. And I think what we found as well is that these principals are so resilient, they're resourceful, they really try and do as much as possible with the resources they have available. But at the end of the day, that can't fill the gap of systemic support that's needed from government. So it's great that they are doing this and that they take on the sense of responsibility, but that can't take the place of where things really need to be put in place.
Sure, such an important study. Thanks very much indeed for breaking it down for us. Really do appreciate it. Professor Catherine Draper is with Wits University. She's a public health and social scientist, public health expert and a social scientist with that institution. Once again, Prof, thanks very much indeed. All right.